Greetings and welcome to the February DSO Roundtable. This is Linda Harvey, Founder and Chief Knowledge Officer for the Dental Compliance Institute. And today I'm thrilled to be welcoming two special guests, Dr. Aditi Agarwal and Rebecca Bouldin with Practice by Numbers. Dr. Aditi is a co-founder and practicing dentist still, so she's a very busy lady. And Rebecca is the Senior Manager with Partnerships. Their program, Practice by Numbers, represents an all-in-one solution to enhance and customize your practice and streamline your processes to be more productive and work smoother and easier. I don't know about you, but those hit a lot of buttons for me. So welcome, Aditi and Rebecca.
Thank you so much, Linda, for this wonderful opportunity to speak to your audience. And also thank you for all the support for Practice by Numbers.
Oh, it's my pleasure. My pleasure. This is a topic that's so near and dear to my heart because when we talk about smart communications, smart data, smarter communication, rather, it's all about the communication. And one of the things that I train on is risk communication and how to be safer in a dental practice by communicating better and more efficiently. And all that communication is not all happening 100% chair side when we're sitting almost, knee to knee with the patient, so to speak. It's happening in all other ways. So please go ahead and share with us what information you have so we can have smarter data and smarter communication.
Awesome. Well, thank you so much. Thanks for joining us today. My name is Rebecca Bouldin. I, as Linda mentioned, work with dental organizations to help them streamline operations through data-driven insights and technology. And I primarily work with our partners. So I'm thrilled we could be here with you and our partner, Dental Compliance Institute. So thank you so much, Linda.
Yes, my pleasure.
All right. And give me just one moment. Let's see here. Fantastic. So as Linda mentioned, smarter data, smarter communication. And I want to start off with a question. So what challenges do you have today that make it difficult to, one, find the data that you need, things like medical health history, specific procedure counts, and B, make that data work for you? Prove compliance, team bonuses, etc. So I'd like for you to think about that, and really as we go through this, ways that you could improve, right? Because compliance isn't just about checking off regulatory boxes. It's about making sure that your organization runs efficiently, that patient data is accurate, and that your operations drive sustainable growth. And at the center of all this is technology and data. And so one of the biggest struggles I've heard from working with DSOs is that their data, it's scattered across multiple platforms. You have your practice management, you have your billing, patient communication, and it makes it incredibly challenging to find what you need when you need it. I've also heard the struggles of data accuracy. How do you know that you have good data? How do you know that your data has integrity? And having a direct API to the practice management system, it's crucial because it means that there's not that third party when data is being transferred. And a frequent sync, ideally, every 15 minutes or less, it ensures that data is always up to date. And so what's the solution? A centralized system that integrates all these data points and can provide you with easy access to provider performance, treatment acceptance rates, AR information, and much more. So instead of having to dig through spreadsheets, different Google Docs, multiple logins, everything should be available right there at your fingertips. And what's really important, not everyone's fingertips. There should be different levels of access for different users. There's some data that might be useful for the part-time assistants in the offices, but you should have a different level of access for yourself, your clinical managers, operational managers, C-suite. And so I'd like Dr. Agarwal to give an example that really just highlights how finding data quickly can help you.
Absolutely. Thank you for that, Rebecca. And, I am a multi-practice owner myself. And one of the key challenges of being a multi-practice owner is basically understanding your best performance, understanding who is, how to reward certain team members in your practices, and also how to see if your certain acceptance rate, for example, if your treatment acceptance rates are low, what is the reason behind it? Is it because the patient is hesitant? Is it because we are having scheduling issues? How do you understand all of that unless data is all kind of in one place and synced frequently, especially when you have multiple offices? And having a single source has really, really helped me streamline. It has helped me not only improve workflows within my own staffing, but also connect everything between the data that is the business intelligence part of it, and also help me give actionable insights for my staff members to put into action certain things that can then help in greater patient satisfaction.
Great. And yeah, really, I mean, thank you for that, Aditi, because the key takeaway here, and I think you can all agree with this, is that data efficiency, it saves time, it reduces compliance risk, and it enhances decision making.
Rebecca, you're singing my song here. Okay? So when you talk about it's much more than checking a compliance box, absolutely. And the compliance is much more multifaceted than what sometimes we typically think of as like OSHA or HIPAA training, for example. So it's much more than that, because now we're talking about the world of coding and billing, and we're also talking about patient communication and patient safety, a lot of important areas. So first takeaway that I had was that systems are fragmented, because I even thought of a couple of other third-party type programs, Rebecca, than the ones that you mentioned. And sometimes when a analytic program is sitting on top of your practice management system and on top of your patient communication tool and other programs, now we have a lot of security risk. So talk about compliance there, because you have many more weak links in the system, I will say, links in the system that could possibly be weak. And with today's security system and the pending security rule updates, it's important to be secure and profitable and have a smooth running practice, as Dr. Aditi said, all in one.
Absolutely. Love the takes. Thank you. Keep them coming, Linda. So I have another question for our audience, and it's, what are your biggest challenges when it comes to centralizing your operations across multiple locations? Because, when data is siloed, compliance oversight, it becomes unfortunately sometimes a manual error-prone process. And from my conversations with compliance officers like yourselves, I've heard that you're left managing multiple reports, tracking provider licensing separately, struggling with audits. And the solution really is this single source of truth that integrates financial, clinical, and patient engagement data, because it can ensure that reporting is consistent across all locations. Automated tools that can keep all these together and monitor provider performance in real time are just essential to help you with centralizing your operations. And so, Dr. Agarwal, could you give us a real world example?
Absolutely. Thank you, Rebecca. So,
Sure.
one of the things that is very, very key for every office is their consent forms, as we know, right? We can't move forward without our consent forms. And what happens is that back in the day, we would send the front desk was responsible for getting the consent forms to the patients. And sometimes I would be in the middle of a procedure and started a procedure and would find out that the consent form hasn't been gone over with the patient. The patient hasn't signed it. And we would have to stop in the middle of the procedure to go back and go over the consent form. And that is one of the really key components of every person's medical chart, is to have that consent form present. And what that would result in is a lot of wasted time, because I have to stop and go back and get everything filled out and go over everything. So that would cut into my treatment time. Automating things like consent forms has made things so much simpler for me. Now what happens is my front desk person will send the consent form the night before to the patients that are going to be seen the next day. And if we receive those forms, the front desk person during the morning huddle will go over, make sure those consent forms are signed. If they are not, they will contact the patient before the appointment and say, hey, how can I help you? Are there any questions related to this so that we can go over it before your appointment? So that has saved us so much time, and has also saved us many, many headaches. And also when the patient is in the chair, you're not scrambling, running around, having them sign forms that many times don't ever make it to their medical chart because somebody again forgot to scan it and put it in. So having these automated forms, which then write back into your PMS, really helps to reduce errors and human errors that can happen, and also provides a much more seamless experience, both for the patient, the staff, and more than anybody, for myself as a provider, because now I can just focus on the dentistry rather than the paperwork.
Yeah, fantastic. Centralizing data, it improves transparency, it reduces those manual errors that Dr. Agarwal spoke about, and it can help you with streamlining your audits as well. Linda, your hot take?
Yes, absolutely. Well, I have 3 points here between both of you, Rebecca and Dr. Aditi, but I'm going to also comment about your takeaway here on the screen. When you say reduces manual errors, I'm also thinking reducing medical errors. And I'm going to come back to that to just a moment. But first, I want to say that you mentioned centralization, and you mentioned when processes happen in silos. And a silo is a really big concern in any size organization, because when you think about enterprise risk management, which is the concept of a very broad scoped risk management plan that corporations need, that you can't afford to have silos where people in different departments and key management people aren't communicating effectively. They're not communicating with the practices effectively, because then there's duplication of information. There's information that's not done that you think is done, and you have a lot of waste and just things happening in a practice that aren't efficient, as Dr. Agarwal mentioned. And then also, Dr. Agarwal, you were talking about automating the consent forms, and that to me is such an important legal process. That's key. I don't think I know of any other program except for Practice by Numbers that's doing that. Mostly you'd have to have another third-party program sitting on top of your software that you have to monitor, pay for, and hope that their links are all secure. So there's some really valuable points here in what you both mentioned. Thank you.
Oh, we love it. Yeah. No, thank you so much, Linda. I have another question for our audience. I want to get you thinking, interacting with us a little bit today. So, when you're evaluating your DSO success, do you prioritize financial performance, things like revenue, case acceptance, or is it patient experience, like patient satisfaction or retention? And what if you could seamlessly connect both of those? And so really, group practices that I've spoken with, they tend to either look at one or the other. They look at the financial performance, those KPIs, the revenue, case acceptance, or they look at the patient experience, satisfaction, retention, treatment adherence, but rarely both together. And the problem is that these are interconnected quite deeply. When you have both business intelligence and patient data, it's beautiful. You can see the full picture of why certain trends are happening. And so, Aditi, I'd love for you again to give us an example of this.
Absolutely. Thank you, Rebecca. So, as they say, garbage in, garbage out. One of the main things about having data, right? It needs to be accurate. And I'll give you an example about something very simple like insurance verification. Okay. All of us offices that are PPO offices do like to check insurance and make sure that the patient has benefits. This is something that we all do for our patients, and as so much so that it is now more or less an expectation by the patient that this be done for them. Now, how do we know that? How can we get correct insurance information? It is all based on the information that we receive from the patients in the first place. And many, many times those patients are making these appointments when they are driving, or they are, usually in a place where they don't have their insurance cards with them. So now when these appointments are made on the phone and half the information is given or inaccurate information is given, this leads to a lot of frustration in the team members when they are responsible for then getting those breakdowns and they are inaccurate or they are not able to get them. And when that happens, they get frustrated because now they're playing this cat and mouse game that they're constantly trying to reach out to the patient and say, hey, can you please provide this information? We really need it. It's almost like to a point where I have seen in my years of practice that my front desk will go to a point where they are literally begging that patient for giving that information before they come in. And now with a tool like Practice by Numbers, we automate that. So what we do is we send out this form and with a request to fill out the insurance information at the patient's convenience online. And when we do that, they are also requested to put in a copy of their insurance cards. What that does is reduces a ton of errors that could happen. And there is an also a sort of a need to give this insurance information within 48 hours of seeing them. Otherwise, we say we cannot see them, they cannot schedule the appointment unless we have all the information and it's accurate. This reduces a ton of stress, not only on the patient, it also reduces the stress on our team members. They're able to get the information that they need in an accurate manner, in a timely manner, so that when that patient comes into the office, we are now saying, hey, we are ready to go. We have Mr. Jones' information. We have their history. We have their frequency. We have everything all seamlessly put into their document center or smart doc or whatever software that is used or PMS that is used. And this leads to less errors in their treatment plan because now their breakdowns are correct, and leads to a much better patient experience because now we have streamlined all the steps. Because if we have a treatment plan that's wrong or incorrect, then this affects what they would have to pay at the end for treatment. And you don't want to end up looking like you don't know what you're doing. So it's great to start with having a process that helps you get accurate information so that in the end, when you have a patient walk out the door, you have better patient acceptance because now they fully understand, their treatment, and also they understand what their financial responsibilities are without much change, which is very, very important.
Absolutely. The ability to combine that patient engagement data with the business KPIs, Dr. Agarwal mentioned case acceptance, right? You can see, okay, if we have accurate information coming in from the patient themselves, because they were able just to take a photo of their insurance card, and that office has exactly the same information that the patient has, it's going to help give you better oversights into risks, financial health, retention trends within the practice. It really completes that whole picture and makes things a lot easier for the office and the patient.
I definitely love the picture that you're painting, Rebecca and Dr. Aditi. This is so comprehensive because when you think about having smart business intelligence, you diminish the waste that I talked about just a minute ago when a tip that I offered. And that's wasted resources. So it's wasted people hours and it's wasted finances. And it creates the frustration. And as you mentioned, employees aren't as happy, they're running around crazy and wondering why every day is crazy busy and why can't there be some method to the madness so it goes a little smoother. So super important with the timeliness. And I wanted to circle back and just mention when you talked about the huddle a few minutes ago and being able to look at the consensus at that time, that is such an important time frame because more times over, I bet many practices and many organizations and their huddles, they're only talking about money. They're not talking about quality of care and patient care to make sure everything's on track for that day for the patients that they're going to care for. So super important. Thank you.
Thank you again for your hot take, Linda. All right, so I have another question for everyone. How does your DSO currently turn your data insights into actionable strategies? Because data without action is meaningless. And one of the best known futurists in the world put it, vision without action is merely a dream, and action without vision just passes the time. Vision with action can change the world. So once insights are gathered, you need structured strategies to address these gaps. Talented and really putting in the talent and putting in that targeted campaign. It's a great way to be able to take action. Send action via email, via text, but how you send emails and texts, it's really important too, by finding a solution that encrypts all data in motion and also does regular penetration testing to ensure that they're secure. So what's the solution here? The solution is data-driven campaigns that can include patient-facing things like patient reactivation for unscheduled treatment, last-minute cancellation campaigns to fill hygiene openings or do internal things, right? And then last is staff performance coaching based off of KPI tracking. And so I know Aditi really loves using practice by numbers custom campaigns to make things easy for her teams. But
Absolutely.
so I want you to take it away.
This is where I think my team, it's their happy place, is what I say, is sitting on custom campaigns. I don't think, honestly, any of my team members have picked up a phone in a very long time for certain specific situations. And, one of them is, as Rebecca talked about, the hygiene holds. Those happen every day, people cancel. And we all have quick fill lists that every practice pretty much has it. And so with these quick fill lists, the great part about a customizable campaign is that now we have, say, 10 people on that list. Why front office person will create a custom text or an email and send it out to those 10 people saying, hey, we have a hygiene opening this afternoon. Do you want to take it? And you know what? 9.5 times out of 10, somebody will take that appointment. And all this happens without picking up the phone, without a single phone call being made. The patient responds via text or email, and that appointment is fulfilled, right? And that's just one of the ways we use our custom campaigns. Sometimes we use custom campaigns to say, we have a snow day and we can't make it into the office. We will then send a custom text out for all the patients scheduled that day and say that, we've bad weather. I'm sorry, office is closed. We will call you to reschedule. And again, it's all done by literally one click. And patient reactivation, you can reactivate the patients that you haven't seen or that have unscheduled treatment. You can create filters by saying that, okay, I want to only call those patients that have unscheduled treatment, that have no pending insurance claims that are open, and that are haven't been, or the treatment has been scheduled in the past 3 months. So you will get the kind of patients that you want. You can really filter it down and send those campaigns that way. And you will see that the patient acceptance is much higher if you create all these, make them really, really customizable, because now you're very targeted in your campaign. And then, of course, staff performance. You know, the biggest blessing, I think, of using the data that we have and then making it customizable to, or individualistic to, each team member is really a no-brainer. Because now what happens is each individual in the practice has a goal of their own. It is no longer set on just production or just collection, and there's no fighting between the front office team and the back office team who's kind of pointing fingers at each other that I didn't make a bonus because they didn't produce enough, or I didn't make a bonus because they didn't collect enough. Now it is more performance-based individually. So what that really, really helps in is that it is a great motivator for your teams, because now they know that they have a goal and they have their own goal that they have to work toward. And that really helps, you know, in team retention more than anything else. So connecting data with insights and then into action is really, really key. And I think PBN does this seamlessly.
Great examples, Dr. Agarwal. Key takeaway here is that, those data insights that you gather, they shouldn't just sit there. They should drive targeted strategies that are going to improve both compliance and operational efficiency. And so, go for it, Linda.
Well, thank you. So when you think about targeted strategies, it's not about doing like a little tactic here and a tactic there. Say, oh, we need to work on hygiene schedule this week. And then tomorrow you change gears. Oh, we've got to work on this. This is falling behind. And it's like playing whack-a-mole, those old games. You have to be targeted. You have to be strategic. And particularly the campaign that you spoke about, Dr. Aditi, I think that's a really smart feature, because you're making it effortless for the patient to come in and keep your practice busy and full. And then you're also making it easy for the team, which increases their staff morale and retention. So very good.
Absolutely.
Awesome. Well, I have one last question for our audience, and that is, how does your DSO currently measure the success of new strategies? Are you, tracking progress with clear KPIs and continuing to track that progress, or are you doing something else? And a major gap I've seen in DSO compliance is the lack of tracking progress effectively. Many DSOs are super excited to implement new strategies, but don't necessarily always measure their success and continue to keep measuring their success. And so the solution here is just to set clear, measurable KPI goals. Use automated reporting to track really whatever you want to track. But some of the things I highlighted are, patient response rates, appointment completions, and the revenue impact. And so this is something that I want Aditi to walk you through, just kind of what you're seeing on the screen right now when it comes to campaigns.
I mean, I'll just, highlight one of the campaigns because we do so many. So it could take me all day to go through all of them. But like, for instance, the recall campaign, right? As you guys can see, we track the recall campaign through automation. And this actually, you can see the impact of revenue that it had on my revenue. So the exact how much the revenue increased by putting a campaign out like this, in terms of not only did it increase the number of patients that we saw, right? So by patient reactivation, but you can also see a clear financial picture that look at the amount of dollar increase that we saw just by instituting this campaign and then following it. And then, of course, making sure that we track it because that's important too. You start something, you got to finish it, and then you keep on having to measure it, because that is the point of these campaigns.
Yeah, absolutely. Regular data reviews ensure continuous improvement and prove the ROI on operational changes, or prove that there's not a ROI on that change and you need to rethink it. But having that data right there at your fingertips, it makes it much easier to track what you're doing, ensure that you're doing things accurately. And in the instance of the example that Aditi gave, that you're communicating with your patients in a way that's receptive.
Rebecca, when you think about communicating with patients, it's about that continual communication with them, because it keeps them tied to the practice. Oh, they're thinking about me. Oh, I could come get my teeth cleaned, this week instead, or I have to reschedule after anyway, so let me come in at this quick appointment. So you never know what your personal schedule could be. When you get a message like that, it's very inviting to change up your plans and go ahead and get that dental care taken care of. Sometimes we just need those little prompts in our crazy busy world, and it is about continuous improvement. And in the medical world, I'll share a similar phrase, that's continuous quality improvement. And so you're improving the quality of the practice and the quality of the care that you offer the patients as well.
Absolutely. I couldn't have said it better myself, Linda. And as we both highlighted today, growth isn't just about seeing more patients. It's about operational efficiency. It's about compliance adherence. It's about patient retention. And so I'd like Dr. Agarwal to use her practice as an example again.
Thank you, Rebecca and Linda. So, I'll tell you about, as a dentist, right? I love toys. That's always been, whenever anything new came out in terms of dental technology in the back, that was where my focus would be, right? I would be like, okay, I want to learn how to implement this new scanner. I really want to learn how to use this new CEREC machine, or the milling unit, or, a CBCT. That's great, right? But then it's all about, how do I get the word out that I have even all these wonderful things that I'm trying to implement in my practice? How do I get the patients to buy in to this, right? To all this new technology, right? Do I have to see more patients, or can I just make it better with the patients that I already have? And I, after 22 years in practice, can tell you this very, very firmly, that it is about creating a better patient experience. And when we can create that, not only by the tools that we have of our trade that we keep making better, like the CBCT and the milling units, and all the cool things out there, but even with just the simple things of how they feel when they come into the practice, how it is that you value their time as much as they value yours, right? What are you doing to help them have that very painless experience all the way from the minute they walk into your office till they leave, right? And I do that by systemization. I do that with various little changes in just our day-to-day in the practice. So in my practice, on a typical day, I have 2 hygienists and myself, I run out of 2 chairs. And for example, I'll give you an example of when I'm doing a hygiene check, right? Many times, patient will come in, I go in, look at everything, it's great, they don't need any treatment, no bugs in the hood, they're good to go. I tell the patient both the patient as well as the hygienist, we're looking good. We don't have to see Mr. Jones for another 6 months. Everybody's happy. The hygienist says, okay, well, Mr. Jones, let's get you scheduled for your 6-month cleaning right then and there in the operatory. And he is scheduled out. And when he does that, he gets a reminder on his phone right away. And she'll say, take a look at your phone. You will get a calendar invite to this appointment. Patient puts that on his calendar 6 months from now. What that helps us do is very likely that patient will show up now because it's already on his calendar before he walks out of the operatory. And the second thing is that it reduces the chances of him not showing up for that appointment because he forgot, because now he can't, because it's on his calendar. And so it makes, it reduces that one likelihood of that appointment being a not completed one, which is a big deal going down the road. The
They
other
also,
thing, go
I
ahead.
just want to interject, like, I love this because they also don't have to stop at the front desk on their way out, right? You've already taken care of this this no treatment hygiene patient.
Absolutely, absolutely. For us, it's like, playing Monopoly. They're good to go. They don't have to stop and they just go. So when I have patients though who need treatment, and every office should try to incorporate same day treatment, and we do the same if it is feasible. And say this patient has same day treatment and I am able to do it, then my hygienist will communicate with my front desk person through our inter-office communication system through PBN and let her know that the patient in the chair has treatment. Dr. A has said she's able to accommodate it. Can we move forward with the process? So the process is that the front desk person will bring up their treatment plan on our iPad, bring it to the room. She will go over it with him. He will sign it, especially if it's a consent form that needs signing, for example, if it's an extraction or a root canal or whatever. And after he signs the form, she will give him an option to pay right then and there through our online payment system. They can pay for the treatment. So she will say, hey, then once you're numb, you don't have to stop at the front desk. You can just, you can go home after your appointment is done. And so we take care of the online payment right then and there. And now that that part is done, my hygienist will numb the patient. The patient, in that meantime, while she's numbing the patient, my assistant will get the room ready for that patient. And then we move him over to the room and I do the procedure. And for some procedures, for example, like the post-op, like the extractions or root canal procedures or anything more involved, I do like to give the patient post-op instructions, and we send those automated to the patients. So they get an email or a text with all the instructions. And you know what? The best part is you can also, especially for after extraction patients, because they're so nervous and stressed out after being in the chair, they just want to be like, oh, I'm done. I want to get out of here. And so they're not always listening to the instructions that are given to them. So this has been a huge practice builder for me because I have my assistant record a 1-minute post-op instruction for the patient. And so this is like, taking care beyond the operatory. This helps the patient. I have had so many patients call back and say, Dr. A, your team is wonderful. You're wonderful because we feel like we are cared for even beyond the operatory because we are so nervous and so tired, and after the procedure is done, we just want to go home. And then when we get home, and then we're like, oh no, what did the doctor say about, do I spit or do I swallow? What, sometimes it comes down to simple things like that. And then you have a video with the post-op instructions on it. It's a huge practice builder. So I would definitely say, there's certain things that we need to remember, that it is possible to really build our not only our team morale but our patient morale, and how much they really important to build the care beyond the operatory.
Absolutely. Really, the key takeaway I hope you guys all take from this is that data-driven decision making, it leads to better compliance. We now have post-op instructions and documentation that we've sent out post-op instructions to all the patients, right? It sounds like putting these processes in place, streamlining the operations, has made it a better patient experience and a more effective time frame for Dr. Aditi's office team. And then doing all these things is going to help you lead to sustainable growth and higher patient satisfaction, all by incorporating systems and incorporating technology.
So, Rebecca, when you think about the whole process of streamlining that process that Dr. Aditi mentioned, especially like post-op instructions, it minimizes the opportunity for he said, she said, or she said and he didn't say. And they were all supposed to, everybody along the way was supposed to tell the patient about the post-op instructions, and then nobody did it. I guess it reminds me of the somebody, nobody, anybody, and everybody story. And so this way it's done. You can all sing the same song and say, we sent that to you via text, or you're going to get it via text. Did you get it? And when they're checking out, especially if they have a driver with them, because they didn't want to drive, they're going to have some extractions or something, then you can let their driver know they got a text. This is all the instructions right there. So as soon as you get home, have them check their phone. So it's so smooth and easy. And I want to just say that happy patients don't sue. And when you have those different touch points of communication, they feel loved and cared for. So if a medical error occurs or something untoward, then they're less likely to see you because they're more likely to forgive you and realize you did your best and something happened unexpectedly.
Absolutely, Linda.
Absolutely. Thanks. Thank you so much, Linda. So really, we're just wrapping up. We've covered how, centralizing data, leveraging automation, connecting your business intelligence and your patient engagement, it can transform compliance from, an operational burden into your strategic advantage.
Yes, so definitely everybody, take time, take action, look at the insights that you have and really put them into action that works for you. Whether it is running a compliance audit or exploring automation for reporting or oversight, either one, right? Or both. And also making systems and integrating them and get better visibility in both into your practice and also give visibility, right? It's get and give. It's a give and take both. And once you have visibility, it needs to be shared. I share my numbers with my team. We celebrate goals and wins together. And so it's not a me, it's a us situation now. And it's a wonderful situation to be when it's an us situation. So really, I want to leave you with something that I came up with, and this is what I motivate my team with. And really, I tell them, like, stop looking for systems just to do things, right? We need to look for systems that really change patient experiences. And that is the key thing of how we can move forward in today's world.
Absolutely. Thank you, everyone, for your time today. If you'd like to continue this conversation, feel free to reach out to us with any questions that you may have.
This was perfect because I love that quote. Thank you both. First of all, I'll say both. Thank you both, Dr. D and Rebecca, for providing this invaluable information for our members. So when you think about looking for just things to do, if you're looking for things in a practice, it becomes busy time. Listen, how can I fill my time as an employee so I look busy? You're just doing things. And as I mentioned earlier, when you talked about strategic planning and being strategic in your processes, that's not strategic. It's just a tactic here or a task that each employee is doing, and it's not synchronized together. So you have this harmonized and it's brought together, and just a win-win from the very beginning, as I wrote all my notes down, to prevent fragmentation, to prevent being in a silo, to communicate across the organization at all levels, and make the patients feel and know that they're loved and you're cared for in your practice. Thank you both for being here.
Absolutely. Thank you, Linda.